morning everybody, that I'm going to present about the diagnostic value of the cardiac biomarker N-terminal pro-brain-natriuretic peptide on severity of chronic heart failure associated with echocardiography measurements in Sri Lanka. It's a preliminary study. The prevalence of heart failure, which is predominantly a disease of elderly, is likely to rise in South Asia due to many etiologies. Also, the diagnosis of heart failure is in multi-system diseases is challenging. Therefore, the cardiac biomarker N-terminal pro-brain-natriuretic peptide is used to diagnose chronic heart failure in early stages. When we look at what is NT-proBNP it is secreted due to the activation of precursor gene BNP gene in cardiac myocytes due to myocardial wall stress, due to the pressure overload and due to the volume overload. And then the pro-BNP hormone, the enzyme cleaves into BNP, which is active, and NT-proBNP, which is functionally inactive. This is the diagram which shows that enzymatic cleaving of pro-BNP into NT-proBNP and for the BNP. In my study, the objectives were to find the association of NT-proBNP with echocardiography measurements in chronic heart failures and to establish a preliminary reference range in the diagnosis of chronic heart failure in Sri Lanka. The study methodology, there were 76 chronic heart failure patients whose ejection fraction was less than 50 and 76 controls without heart failure, and also all of in each one the echocardiographic measurements such as left ventricular end diastolic diameter, left ventricular end systolic diameter, and left ventricular ejection fraction were measured. The study was taken place at District General Hospital, Calcutta, and the ethical approval was obtained from the Ethics Review Committee, Faculty of Medical Sciences, University of Sri Lanka. From each participants, I have collected 3 ml of blood and they were centrifuged at 3000 rpm for 10 minutes. And the serum was stored under -40 Celsius until analysis was done. And the NT-proBNP assay performed with the commercially available kit according to the manufacturer's guidelines. Millimeters NT-proBNP assay was used, which is an enzyme-linked fluorescence assay performed with an automated millimeters analyzer. And the assay range was 15 to 25,000 picogram per milliliter. And also we measured serum creatinine level using corneal clinical chemistry analyzer, because impaired renal function was a potential confounding factor for the clinical value of NT-proBNP. Clinically, as that NT-proBNP gets clear from the kidney. So, clinical implications derived from natriuretic peptide levels in a given patient require creatinine clearance consideration. The statistic SPSS version 16 was used to analyze the data. There were 2 groups, chronic heart failures and non-chronic heart failure control group. And the NT-proBNP values were compared by non-parametric man-Whitney U test, because it's not normally distributed, the data was not normally distributed, therefore we used non-parametric man-Whitney U test for the analysis. And the 95th percentile was used for the establishment of cutoff value, and the Spearman correlation was used for the correlation assessment of NT-proBNP with the groups of left ventricular Also, assessing the effect of predictors of left ventricular ejection fraction was feasible using multivariate logistic regression model. There, ejection fraction was used as the dependent variable and NT-proBNP as the predictor. When we talk about the results, there was significant difference in mean NT-proBNP level in chronic heart failure patients is 1,007.4 and when compared to controls, it's only 6 to 9 picogram per milliliter. Based on the results of healthy individuals, 169.4 picogram per milliliter was established as the 95th percentile to stratify heart failure. Also, chronic heart failure patients had significantly higher NT-proBNP levels than those with normal LVED and LVESD values. This shows the quantitative relationship of NT-proBNP in CHF and control. Also, in European countries, they have established 100 to 500 picogram per milliliter as the heart failure possible diagnosis value. Also, there were significant differences of NT-proBNP levels found between patients with different ejection fraction levels. Also, it was respectively 4,140 in the patients whose ejection fraction was less than 30 and 69.61 in the patients in the control. There were no significant difference in NT-proBNP concentrations in male and female. Here, there is a summary of my results where the echocardiogram parameters and NT-proBNP measured. Therefore, measurement of NT-proBNP and BNP levels are increasingly utilized in evaluation of patients with suspected chronic heart failure. NT-proBNP gave higher sensitivity, lower specificity and higher negative predictive value. So the advantages of using natriuretic peptide is to screen large number of patients of risk of left ventricular systolic dysfunction is a good diagnosis as a good diagnostic method to diagnose left ventricular systolic dysfunction. Also, this would allow patients with left ventricular systolic dysfunction who have less classical symptoms as well as asymptomatic high-risk patients to be identified and in turn referred to the echocardiographic evaluation and treatment. Also, NT-proBNP assays cannot replace cardiac imaging, but both provide independent and complementary information for the evaluation of cardiac function. In particular, increased NT-proBNP concentrations in patients with suspicions of heart failure are highly suggestive of correct diagnosis. On the other hand, in patients with low NT-proBNP concentration, diagnosis of chronic heart failure is unlikely. So, as the conclusion, NT-proBNP is the important biomarker for the diagnosis of chronic heart failure. The cutoff level is for the Sri Lankans as a preliminary study is 169.4 picogram per milliliter to exclude heart failure, and NT-proBNP level gets increased in increased LVED and LVSD as a stress response, and NT-proBNP inversely proportional to left ventricular ejection fraction.